It is a common condition that affects 35 million men and 21 million women in the U.S. alone. The scientific name is androgenic alopecia, but we know it as hair loss or baldness.
There are many causes of hair loss, including hormonal, autoimmune, and stress. But the commonest cause of hair loss, which we also call as common baldness or androgenic alopecia, is genetic in nature.
Studies have revealed that people with hair loss often report that it puts them at a disadvantage in their personal and professional lives because of a lack of confidence and self-esteem.
Baldness or hair loss definitely leads to a lack of confidence, especially nowadays when we see younger and younger people getting affected by this. Even in late teens, we are seeing people who are losing hair. It leads to a lack of self-confidence and how they perceive themselves and how others perceive them. Secondly, in the professional field, it is definitely a disadvantage.
There has been a growing trend of more men and women around the world turning to hair restoration surgery to look younger and feel more self-confident.
Hair restoration surgery has evolved dramatically, especially in the last 15 to 20 years. Whereas in 1990s, most of the procedures were performed by taking out a strip of skin from the donor area. Now the stitchless fuse technique has come up, which more and more people prefer that, because in this method we can take out the donor hair individually without leaving any scars. This also helps because people can now use even the beard and body hair to transplant them onto the scalp, giving them a fuller restoration.
Dr. Arvind Poswal is widely regarded as one of the best hair transplant surgeons in the world. He is the inventor of the fuse technique and instrumentation and has pioneered many of the latest advances in hair restoration surgeries.
We perform basically 3 different types of procedures. The first one being the strip procedure. In the strip procedure, we take a strip of skin from the donor area. That wound is closed using sutures or staples. The strip is then dissected into individual hair follicles, which are transplanted into the bald or balding area. But the other method, which is becoming more and more popular nowadays, is the stitchless fuse technique, in which the hair follicles are taken out individually. So there is no cutting, no stitches, no scar resulting from the stitches, and also hair can be used from the beard and the body donor areas to give a fuller hair restoration. The third thing which we use is called trichopigmentation. This is especially beneficial for people like those who are in early stages of hair loss and they are not suitable candidates for hair transplant. In these people, we can do what is called a micro tattooing. But the only thing being that tattoo will disappear on its own within 2 years or so. So it is like a stopgap arrangement. It helps them tide over that period of time. In my view, beard hair to scalp transplant is a game changer, because now there are so many people, they have such a thick beard and they come to us and used to say, why can't you transplant these grafts on top of my scalp? They used to be really bald. And mathematically, it's not possible to transplant hair from this area and to cover the entire head. But with the beard, if a person has a really strong beard, he can fill up his head totally.
As hair restoration surgery continues to evolve, hair restoration surgeons like Dr. Poswal will stay on the cutting edge.